afternoon by Commissioner Jeanne Lambrew of Maine's Department of Health and Human Services. Commissioner Lambrew and I are here to provide everyone an update on the COVID-19 situation across the state of Maine for today, Thursday, August 27, 2020. Overall, right now in the state of Maine, there are 4,414 cases of COVID-19 statewide, representing an increase of 25 cases since yesterday. Of those cases, 3,961 are confirmed, an increase of 19, and 453 cases are probable, an increase of 6 cases since yesterday. Overall, 415 individuals have been hospitalized at some point during their illness with COVID-19, and right now in Maine, 9 individuals are currently in the hospital, 5 of whom are in the ICU, 1 of whom is on a ventilator. Overall, across the state, 132 individuals with COVID-19 have passed away, and 3,847 have recovered, an increase of 29 recoveries since yesterday. Among our cases are 973 healthcare workers. I'd like to next turn to an update on some of the outbreaks in which Maine CDC has been most recently engaged. Let's start with an outbreak connected to a wedding in Millinocket that occurred a few weeks ago. Overall, there are now a total of 87 cases associated with this outbreak. This number, this 87, includes not just those who, for example, attended the gatherings on August 7th in Millinocket, the wedding and the reception. It also includes now 9 cases at the Maple Crest Rehabilitation Facility in Madison, as well as cases associated with the York County Jail Complex. Because we have identified an epidemiological link between and among all of these cases, they constitute a single outbreak, even though the complexion of that outbreak has changed and looks different in different parts of the state. So let's start with some of the numbers. Overall, as I mentioned, there are 87 cases now in total linked to this outbreak. 30 of them are what are called primary cases. Those are individuals who directly attended the events on August 7th. There are 35 secondary cases. Those are individuals who were close contacts of a primary case, and now 22 tertiary cases. Those are individuals who were a close contact of a secondary case. Of the 87 individuals, 59 of them have been symptomatic, which is about 68% of all of them. If we look at some of the subcomponents of this outbreak, let's start with Maple Crest, where, as I mentioned, there are now a total of 9 cases. 5 of whom are among residents, 4 of whom are among staff. Similarly, at the York County Jail Complex, there are a total of 18 cases, 9 among jail staff members, 2 among other staff members in that building, and 7 cases among inmates. At least as to the York County Jail, there have been no new cases since yesterday, and testing was performed yesterday for all of the county employees. Results should be available soon. In the meantime, a team was dispatched to conduct cleaning. They've completed half of the jail yesterday, and the other half of the jail will be completed today. I'd like to next turn to a brief update on the situation involving cases associated with the Sanford Fire Department. Right now, there remain 4 cases associated with individuals who worked at either the Sanford Fire Department, the Buxton Fire Department, or the Saco Fire Department. Our investigation there is underway as we look for additional potential linkages to those cases and possibly to other cases in and around York County. Finally, or next rather, an update on some of our testing efforts, which is going to be a theme for the day. Let's start with some of our metrics around testing. Based on 3,919 PCR tests reported to Maine CDC yesterday, the 1-day point positivity rate was 0.54%. This brings our 7-day positivity rate for PCR tests to 0.69%. But the real story right now today is not so much the positivity rate, but the testing volume. Our testing volume continues to increase across the state. Right now, that number stands at 273 PCR tests for every 100,000 people in Maine. To put that number in perspective, that represents a 53% growth rate in the past 30 days. But the real action there has not been in the past 30 days, but in the past 7 days, where there has been a 44% growth rate just in testing volume in Maine in the past 7 days alone, a 44% increase in the volume of testing being done across the state. And finally, before I turn things over to Commissioner Lambrew, just a brief note about Maine CDC's approach to testing overall. Many of you may have heard about changes that the United States Center for Disease Control made on their website earlier in the week regarding who should be tested. These changes pertain to individuals who are close contacts of confirmed cases who do not have symptoms. So, for example, if your spouse or your roommate tested positive for COVID-19, there is a good chance that you've been exposed. If you don't have any symptoms, the question here is whether you should get tested. You're a close contact to someone who's positive. Not the Maine CDC, the US CDC changed the website. And what it says now is if you have been in close contact with a person with COVID-19 infection, but you do not have symptoms, you do not necessarily need a test unless you are vulnerable or your healthcare provider or your state health official recommends you take one. Let me be clear. We at the Maine CDC recommend you take one. We have no plans to change our protocols at this time based on the scientific information that we have available and that we have reviewed. In fact, the Maine CDC DHHS standing order for COVID-19 testing, which has been on our website since June, makes it possible for you to get tested if you fall into this category of being a close contact of someone with COVID-19, even if you do not have symptoms. The way that we have been doing this, the policy that we have adopted now for many months, is what is best for public health. Our view is that you don't stop the plows in the middle of the storm, you keep plowing. Or in this setting, you keep testing. Indeed, that is why the announcement that Commissioner Lambrew is about to make regarding expanded testing capacity is such an important piece of our overall approach to COVID-19. So with that, I'd like to turn things over to Commissioner Lambrew.
Thank you, Dr. Shah. Today, the Maine Department of Health and Human Services and Maine-based IDEXX laboratories announced the start of operations at the mobile laboratory stationed at the Health and Environmental Testing Laboratory in Augusta. This quadruples Maine's current COVID-19 testing capacity. Specifically, the state lab's maximum testing capacity is increasing from approximately 6,000 per week to more than 25,000 per week. Some surge capacity will be reserved to ensure the lab is positioned to respond to any future outbreaks. The staff at the state lab have worked tirelessly throughout the pandemic to ensure that Maine people and visitors alike have access to reliable and timely COVID-19 testing results. The mobile lab is critical to expanding Maine's testing capacity and keeping infection rates low as we enter the fall. We thank the IDEXX team for their strong partnership, value collaboration, and contribution to Maine's high ranking among states in COVID-19 response. Also today, we announced we are extending federal funding for our 27 swab and send providers originally scheduled to end on August 31st to October 31st. This support means that these collection sites can offer testing for free of charge to individuals who believe they may have COVID-19 or could have been exposed to the virus with or without symptoms, as defined under the standing order that Dr. Shah just discussed. After October, the Swab and Send will bill insurance companies for their service. The Swab and Send locations continue to increase their volume of specimen collections. For example, the site operated by the City of Westbrook has sent more than 14,000 samples to the state lab since August 3rd. The 27 Swab and Send sites complement the roughly 40 current testing sites already available to the public. For a list of sites providing tests under the department's standing order, which includes all these Swab and Send sites, please visit the Keep Maine Healthy website. And with that, I'll turn it back over to Dr. Shah for questions.
Great. Thank you, Commissioner. Our first question today goes to Allison Ross from WMTW.
Hi, Dr. Shah. Thank you so much for taking my question. So just two questions here. The first, the other new guidance that was put out by the US CDC calls for service workers to not engage with those who refuse to wear a mask. So that also puts those workers at risk. Is this something that the Maine CDC agrees with? And are there going to be consequences for those who break the rules?
Well, Allison, when the US CDC puts out guidance, it's just that. It's a guidance document. In this setting, that was really a document that was intended to equip those who might be interacting, say, in a retail establishment with someone who's wearing a mask. And not so much as a guidance or regulation, but just some considerations to keep in mind. That document to which you refer makes some good points, which is to say, perhaps in certain situations, interacting with such an individual where voices can get raised could actually generate more transmission. So I think there's something to be said for taking a thorough look at that document if you are working in a retail establishment, if you're the manager of one of those organizations. The document itself is not strict regulation. So those who do wish to engage, say the manager of a grocery store, those who do wish to engage are certainly free to do so, and indeed are empowered to do so under the various executive orders that have been put forth around mask wearing.
Okay, great. And then my final question, and I know this was asked on Tuesday by another reporter, but is there any update on the Millinocket couple whose wedding it actually was? Is there any follow-up? Are they actually being cited, or is that kind of a closed case?
No, it's not a closed case. That investigation continues, and we're looking at where they may be and what the circumstances are in terms of their history, when they got tested, so on and so forth. We want to make sure we have all the facts there. Although at the same time, Allison, as this investigation has broadened both in scope as well as in depth, now moving down to York County, moving in to Madison and other places, our real focus remains on getting a handle on the outbreak itself and preventing further cases and trying to mitigate further transmission.
Thank you.
I'm going to turn next to Morgan at WABI.
Hi, good afternoon, Dr. Shah. Thank you for taking my questions today. I have two questions. My first one is, if the MPA decides to have fall sports today, are there more hoops to jump through with the CDC or the state for the kids to be able to play?
I think I'll answer that question. So we at the Department of Health and Human Services received part of the Maine Principals Association's revised guidance yesterday and the rest around noon. We have not had sufficient time for a comprehensive review before today's vote, but do remind everybody that school athletics are not exempt from the underlying requirements during the coronavirus pandemic. The people of Maine have worked hard to keep our COVID-19 prevalence low. We continue that fight, and we will continue to monitor the status of that guidance as well as its implementation.
Just kind of a follow-up to that, is there any sort of timeline for when any more guidance will be coming from the state from any of your departments?
The Department of Education has since the spring worked with the superintendents and principals and teachers and parents on a comprehensive set of guidance for schools. we have worked with them to bolster the guidance that they're providing for teaching with public health guidance. All of that guidance coming from the state of Maine is on the Department of Education guidance. It does include guidance for physical education, for example, which takes place as a part of the educational program. It's universal. All children participate in physical education. At this time, we have deferred to the Maine Principals Association on school athletics. But as I said, we had not had time to review their guidance. And they themselves know that, like all other residents of Maine, our Maine guidance do apply. So we will study that guidance and we'll let you know what we think.
Okay, thank you. And my next question for Dr. Shah is, with students heading back or some already back to school, what would you say directly to students about going back to school, about any feelings they may have, about feeling apprehensive, about things that they can keep in mind during the day and when they get home? What sort of advice do you have to students directly?
Here's what I'd say to kids who are going back to school right now or preparing to go back. The first is we understand and appreciate that you are going back to school this fall under circumstances that no child has had to go back to school under in 100 years. So in that respect, what you're going through is really a once in a multi-generation type of thing. And unfortunately, what it means is that much of the school year that you thought you were going to have ahead of you is not going to be what you thought. For example, for kids who just graduated from high school, they had to forego things like proms and large graduations. For students who are getting ready to go back for this year, a lot of the social events, a lot of the cultural events that you associate with being back in school may not be there this year, or at least for some time. We understand that, and it's okay to be sad about that. It's okay to miss the fun parts of school. But the other thing I would recommend or say to students is that they've undoubtedly seen pictures on social media, I know that I have, of packed hallways in other school districts across the country with no students wearing masks. And then they've probably seen a couple of days after that headlines on the news where, lo and behold, that school ended up having an outbreak of COVID-19. And the possibility of even staying in the classroom, as different as it is, gets taken away and they've got to be back at their computers at home. So what I would ask young folks who are going back to school is they've got within their power to take steps themselves to keep school happening in the classroom so they can continue to see their friends. And that includes things like wearing a face covering while they're in school, keeping distant away from one of your classmates as much as possible, and doing all the things that you've heard folks drone on about for the past 6 months, putting them into action when they're in school, because that'll be the best way to keep rates of COVID-19 down within the school and keep everyone back in the classroom. I'm going to turn now to Charlie at the BDN.
Yep. Hi, Dr. Shah and Commissioner Lambrew. Thank you, as always. I think my questions primarily will be for Dr. Shah today. The first has to do, well, they all have to do actually with the outbreak from the Millinocket area wedding. The first is you spoke before and you mentioned it the other day how a lot of Maine CDC's effort right now is on getting the spread of figuring out how far this outbreak has grown. And so I'm wondering, can you give an update on where Maine CDC's contact tracing workforce stands, how many contact tracers it has, and then how many of them and how much resources this has sort of consumed, just investigating this one large outbreak?
Mm-hmm. Sure, Charlie. So right now, the Maine CDC has approximately 100 individuals who are engaged in investigating cases of COVID-19 and contact tracing the individuals who are close contacts that are reported by those cases. So to break that down just one more step, when we receive a report of a case of COVID-19, right, we don't get a report from a lab that says there's an outbreak. That's not how that happens. What we get are reports of confirmed cases of COVID-19. And there's a group within Maine CDC called case investigators who reach out to every one of those confirmed cases. And they say, where have you been in the past 14 days? Where is everywhere that you visited? And who is everyone that you've come into contact with? The case investigators are charged with figuring out where they may have gotten COVID-19 from, so-called upstream analysis. And in this situation, a couple of days after the August 7th, about a week after the August 7th event, individuals started getting sick. So they got tested, and those reports started coming into Maine CDC. And our case investigators, who meet, or at least conference now virtually, several times per day, several times per week, sit down and say, okay, I've just interviewed some folks, and here's all the places they've been. And another person lists all their places. And we've got a database that tracks all these things. And lo and behold, we identified a large number of individuals who all reported in the previous week or 10 days being at an event on August 7th in Millinocket. That's one phase of it. The other phase is to take the list of all the contacts that those individuals report and follow up with them to see how they're doing. That's so-called downstream analysis. As you can tell, it's a lot of work. We've got, again, about 100 individuals doing this work within Maine CDC. Their goal is to identify close contacts so as to limit the spread, but also to compare notes multiple times per day, multiple times per week, to try to identify these outbreak situations. They're the ones who pieced together what was going on at the Big Moose Inn in Millinocket. They're the ones who pieced together what had been going on at the jail. And they're also the ones who pieced together the linkages among all of these things. Okay.
So just a real quick follow-up on that, and then a second question. So the follow-up is, of the 100 individuals who do this work, do you know specifically how many of them have been on this one outbreak? And then my other question is, we recently read about, a case in Rhode Island and Massachusetts where there was a bachelorette party in Rhode Island, and then people went back to Massachusetts, and the states were kind of cooperating to investigate that. I'm wondering if on this Millinocket area outbreak, if Maine CDC has been working with any other states to investigate whether it's spread outside Maine, if you can share anything about that as well.
Sure. Charlie, we'll get you the number of exactly how many case investigators and contact tracers have been involved with the Millinocket outbreak in different forms, whether it was with the wedding, whether it was with Maple Crest, or whether it's with the York County Jail. We'll get you the number of that. With respect to other states, what we've actually seen in this situation is, I'm just taking a look here, is that almost all of the cases associated with the Millinocket outbreak are Maine residents. And so we have not, in this particular setting, put out an alert because all the individuals we've identified, save for one, have been in-state residents. But it is very commonplace for us to work with health departments across the Northeast. We've got frequent calls with those health departments, especially when there are large outbreaks that we know straddle multiple state lines. We do that all the time. I think the one that I've talked about the most was several months ago at the Chimbro construction site, where we worked with the health departments of Massachusetts, Wisconsin, West Virginia, and Rhode Island to collaborate to figure out what was going on there.
And I just might add that on the topic of weddings, we appreciate that weddings are occasions where people can gather, often from far away. They love to see each other. Often people haven't seen each other for a while. There's a lot of socialization that happens. But as a reminder, it does pose a risk to those individuals, those families, and those guests, as well as their community, as this outbreak shows. Just as a reminder, under the governor's executive orders, there are limits on the size of gatherings, 50 people indoor, no more than 100 people outdoor with appropriate spacing. There is a requirement to wear face coverings in those settings unless there's eating or drinking happening. And we do remind both the hosts of those gatherings as well as the participants that should there be a violation, we have sanctions such as potentially being charged with a Class C crime that includes punishment of up to 6 months in jail, $1,000 fine, up to $10,000 fine for an institution, and as we've seen in the last few weeks, there are deadly consequences associated with uncontrolled gatherings. So we really do urge anybody who's planning a wedding in the coming days and weeks to take caution, not just because it is the policy, but because it does protect your community.
Actually, I'm sorry, can I just ask one more follow-up on that one, Commissioner Lambrew, which is why in the case of the inn, the Big Moose Inn, where this reception happened, was there was a citation issued, but not a monetary fine? Could you explain any bit the rationale behind not giving a more serious punishment there?
Yeah, I'll begin, and I think we'll begin with an update, which is we did last week issue what's called an imminent health hazard because of what we know was a violation of our policies. There was a return site visit in which there were continued deficiencies. So we have suspended the license for the Big Moose Inn. Every day that the organization operates outside of that suspension, there are fines associated with it. I know we are working with the Big Moose Inn to bring them into compliance because the goal of all of our public health emergency enforcement tools is less about punishment and more about prevention and how do we prevent this from happening again. So indeed, in the case of Big Moose Inn, they are currently under suspension. Unless Dr. Shah, you have an update?
No, that is currently the case. And Charlie, Commissioner Lambrew noted the way that our system of working with restaurants and lodging establishments, campgrounds, et cetera, the way that it's set up statutorily, legally, is monetary penalties are really the last resort, and they are to be used when an establishment is operating without a license. Up until that point, the goal is to work with the establishment to bring them back into compliance. And that's what we do. Fines are really the last step, not the first step.
Thank you very much.
I'm going to turn to Joe at ABC 7 next.
Thank you, Dr. Shah and Commissioner Lambrew. I have a quick question along. Can you give us an update on the PPE situation in Maine and how we're doing? To my understanding that we don't expect to need another shipment from the national stockpile till December 30th. It's being about 3 months away. And I was just wondering if you could give us an update on how Maine is doing with that situation.
Sure. So, let's first kind of start with where things stand with respect to what our supplies are. So right now, I'm not going to tick through the entire list, but I'll just provide one or two examples. So with respect to N95 masks, we've got roughly 360,000 on inventory. We've got about 197,000 cloth face coverings, about 1 million or so gowns. We can get you the full list as well. We've significantly built up our strategic reserve of PPE, even while we have continued to distribute PPE to hospitals, to first responders, and other healthcare providers across the state. Our goal right now is to make sure that that strategic reserve in Maine really is the gold standard for what we should have in the event that there were, say, a significant spike in influenza cases accompanying a spike of COVID-19 cases going into the fall or going into the winter. So even though those numbers seem high, as we saw earlier in the year, they can be utilized and used up very, very quickly if we were to see a significant spike in hospitalizations or an uptick in individuals who are not well. Joe, you mentioned sort of the next distribution. I'm not sure about that. We continue to receive distributions from FEMA and the Strategic National Stockpile, both of PPE as well as of testing supplies. I was actually just on the phone not long ago with our head of emergency preparedness, who was talking about the volume of supplies that we're getting. So I'm not sure. We might want to touch base about the date that you mentioned, because I'm not sure that it's quite right.
Absolutely. And just a quick follow-up. With summer coming to an end and the temperatures kind of dropping, people are going to be more likely to not be able to get outside as much as they are in the summer. And in the coming months, you could see more foot traffic in stores and things like that. Is there any discussion between you and the governor's office about any new mandates or anything that will be coming in to kind of deal with that and not having, because they don't have the ability to be outside in the activities and it's going to be a little colder and people be kind of cooped up? Has there been any discussion between you and the office about those types of situations that could come up?
So we've been talking quite at length, not specifically about any one scenario, but how we are going to be thinking about the future of things like indoor gathering limits, the numbers of individuals who can be inside safely at any one time, and whether there are additional refinements that we could put into place to keep people safe, partly for the reasons you mentioned, which is more and more folks being inside as it gets colder outside. What I will say, though, Joe, is that the numbers and the approach that we've arrived at right now with respect to, say, the number who can be in a retail establishment, it's not based on the summer season. It's based on what we know to be a safe number for any time of the year. So it wasn't indexed based off of temperatures being above X outside or what we expect behavior to be. It was based on what we thought was safe, irrespective of the time of year. We're going to continue to look at how those patterns look like and whether there's new science on the safety of being indoors and how we can make it safer. But I just wanted to provide that color as to how we got to that number in the first instance. I'm going to turn now to Dustin at New England Cable News.
Hi, Dr. Shah. Overall, your opinion, how concerned are you about this outbreak and subsequent outbreaks, given what we know about similar cases around the world and around the country? How does this one stack up? Dustin, I'll give you the concerning and then the not so concerning piece. Let's start with the concerning piece. I think I will start where Commissioner Lambrew noted, which is what we have seen time and time again over the past several months is that there are two factors that drive the possibility of outbreaks: the duration of an event and the density of an event. And what we saw here was an event, a wedding and then a reception, so a long duration event with a fair number of individuals, greater than the 50 that are allowed. So almost by definition, a high density type situation. When we see those two factors combined, time and time again, not just in Maine, but across the globe, we see the potential for outbreaks. What concerns me in this situation is the fact that the number of individuals who were affected from that initial setting, which was to say 27 people, was higher than we would have anticipated. It suggests that there was already transmission happening in Penobscot County by the attendees. And when they came together, it was sort of like a powder keg that was giving off sparks and generated a higher than expected number of cases. That high number of cases then seeded the platform for more cases to pop up elsewhere. Maple Crest, the jail. Basically, when you go into a situation with a lot of cases, you're going to come out with even more, and that increases the likelihood of these secondary and tertiary outbreaks. That unfortunately sets the pathway for more and more cases. It can spiral. That's what concerns me right now, that 80 plus cases could keep growing and growing and growing. That's a risk right now. On the other side, however, we got our head around what was going on quickly. Our disease investigators, our disease detectives were able to spot this, piece it all together, and work with people really quickly to put measures like mass testing into place. Over 400 people have been tested just in Millinocket alone. So there are some positive signs on the horizon, but when you start with such a high number of cases, there's the potential for exponential growth, which is the principal concern right now. A follow-up one on that. If maybe to use a percentage or fraction, and maybe we don't really know, but what portion of the contact tracing is complete at this point, as best you know, or do you?
Well, Joe, contact tracing is really never complete, by which I mean we're always identifying individuals who are contacts, and as those individuals become symptomatic, we then expand the circle of contact tracing one more circle. And if those individuals become symptomatic, we ask them everyone they've been in contact with, and we expand it yet another circle. So it's not as if there's an endpoint at which we say we are all done. We're always checking in with folks to make sure that if they're symptomatic, they're triggered as a case, and then we expand the circle. Contact tracing rates overall, the cooperation rate with Maine CDC among Maine people has been very high. That's a testament to folks in Maine wanting to work with us. But it's not something that we can say we are now done or we are X percentage of the way done. We're always checking in with folks because folks are always getting symptomatic. I'm going to turn now to Amy Brown at WERU.
Thank you, Dr. Shah. I have about 15 questions today. That's all right, right?
That sounds about right.
Okay, good. I'll start actually with one for Commissioner Lambrew. You mentioned that there were ongoing deficiencies found at a revisit to the Big Moose Inn. Can you say what those were and when that happened?
My understanding, it was the routine review of distance between tables, the type of safeguards that they have in place for COVID-19, mostly I think in the physical space, but I think we do, again, inspect with a view to fixing. So I think when our inspector was on site, there was advice given as well as deficiencies noted. But we do have a policy of we give you one notice, and if you on the second try don't pass, we do suspend licenses. We have to take our responsibility to protect the public health seriously.
And that occurred when? When was that second visit? Was that just recently or?
Recent days, yes.
Just in recent days, okay. Regarding the York County jail outbreak, you mentioned, Dr. Shah, that further testing is being done among staff. Was there universal testing already done with the inmates? And I have another question about that as well.
Yep, Amy, I believe so, but I don't want to give you incorrect information, so we'll check. I believe that testing was done among the inmates at the jail. But again, I want to just double check so I don't give out anything that's incorrect.
Okay. And has it been confirmed whether the staff member at the jail who contracted the virus at the wedding and then returned to work at the jail, several inmates have contracted the virus from that staff member. So has it been determined whether he or she was wearing a mask while they were at work? And if not, will there be consequences because of all the people that they infected?
Sure. So that's part of the investigation that we're working with the officials at the jail and at the county building to try to determine both whether that individual was wearing a face covering or mask, and then more generally, what is the policy within that facility with respect to mask wearing, face covering while at work. You asked about any sorts of potential downstream ramifications. That's really something we would really leave more to decide once we've got all the facts.
Okay, I'll leave the other 13 for next week. Thank you.
Sounds good. We look forward to it, as always, Amy. I'm going to turn now to Steve Porter at Seacoast Media.
Thank you, Dr. Shah. I have another question about the wedding-related enforcement. We've heard a fair amount about the wedding reception venue. Could you share a bit more about the ceremony and whether Maine CDC sees any religious liberty implications as relevant to the way enforcement is being carried out in this situation? And how is Maine CDC working with faith communities that might be more skeptical of government directives with this sort of thing?
So, Stephen, let me start with that latter point. With respect to our work with faith communities, we work with faith communities in the way that we work with communities of any sort. So when we think about gatherings, to us, it does not enter our calculus as to whether the gathering in question is one that is at a church, associated with the church, not at a church. What we focus on is the gathering itself, not who's hosting the gathering. But we, of course, know that faith leaders are important members of the community and have a lot of folks who are relying upon them for best practices. In this situation, as well as another situation, I actually have personally spoken with a faith leader in Maine who is involved with many of the churches that we've been discussing. And I actually had two conversations with him just a couple of days ago, last weekend, about gatherings, about ways that he can work with his parishioners and congregants to keep events both on services as well as things like celebrations, how we can work with them to keep them as safe as possible. It was a really productive discussion. I had a team member of mine reach out to him earlier today to keep that discussion going. So we've got an open door policy. And when we have these discussions, it's not about who's hosting it. It's really about what type of gathering it is and how we can work with them to keep it safe.
Follow up, if I may, would you be willing to specify the faith tradition or the individual with whom you have had those conversations?
I'd rather not go into person A versus person B, but it was an individual who's closely associated with the churches in and around the Millinocket area. And we had, again, a very, very productive discussion. And I look forward to speaking with him and his colleagues in the future.
Thank you.
Mm-hmm. I'm going to turn now to Hannah at News Center.
Hi, Dr. Shah. Thank you for your time. I have two questions today. The first one for Commissioner Lambrew. What is the state's stance on the so-called learning pods at home? Do parents need to have a license in order to do this? Is there a maximum number of kids allowed without a license?
Sure. So I will do a partial answer because I know the Department of Education is also looking at this. So we here at the Department of Health and Human Services do oversee child care. And there has been this big question coming up. Is a so-called pod where there's a person overseeing remote education for a number of children, is that education or is that childcare? We are working to develop sort of bright line guidance to give parents, childcare providers, and educators some rules of thumb to go by, because we do recognize the fact that there are going to be circumstances where there will be hybrid learning and some children on their off days will be at childcare, they will be remote learning. We're trying to figure out how we can efficiently develop the kind of guidance that will get all people understanding of, is it education? In case the Department of Education will be engaged, as will schools, or is it childcare? So we hope to have that guidance or clarity soon.
Thank you. Dr. Shah, this one is for you. I know that you have confirmed that a pastor from Sanford officiated the wedding in Millinocket. Has anybody in the congregation in Sanford tested positive?
So Hannah, that's a good question. That's part of our investigation right now. We are aware of reports of individuals who have started showing symptoms. Whether they will ultimately test positive for COVID-19 is one of the things that our case investigators are on the lookout for. That's part of the investigation process, the process of taking a look at what's out there and seeing if it's COVID or something else. But I think, Hannah, this kind of speaks to what Stephen Porter asked about, which is I think faith leaders in this setting have an obligation to take steps in events like this, whether it be a wedding or a regular worship service, to keep their parishioners and congregants safe. These are times that we know COVID-19 can transmit. And as we saw in the wedding in Millinocket, a few cases can very quickly turn into 20, which can quickly turn into over 80. And I think as members of the faith community, they have an obligation to work with us and make sure they are doing everything they can to keep people safe. It has less to do with the fact that they're faith leaders and more that they are leaders, irrespective of the type of organization. This is a time for leaders of all sorts to come together and keep people in their world safe. I'm going to turn next to Joe Lawler at the Press Herald.
Yes, hi. I have one question for Commissioner Lambrew and then another question for Dr. Shah. So I'll start with Commissioner Lambrew. Last week you said the MPA would be making the final decision on fall high school sports, but a few minutes ago you were saying that the final decision will be made by DHHS or the governor's office. Can you explain what prompted that change? Was it the Sports Medicine Committee's recommendation for football or some other reason that caused that change?
So maybe I wasn't listening to myself. I'm not positive I said that the department is ultimately making the decision. What I did say, and I'm happy to clarify that, is our general approach to guidance has been, first of all, if there is federal guidance, national guidance that is sufficient, we adopt it. We're not looking to create guidance when it's not needed, if there's perfectly good and sufficient guidance out there. Where there's a gap, where there's a need to tailor that for the state of Maine, we have done that. That's been done partly through our checklist, COVID-19 checklist process. Sometimes it's done through our departments. Our Office of Child and Family Services, for example, did childcare guidance on it, working with our public health experts. In this case, the Maine Principals Association this summer began the process of developing guidance for school athletics. It posted draft guidance. It has sent us, just in the last 24 hours, just in the last few hours, review recent guidance. It did ask us for our opinion. We will certainly provide Maine Principals Association with our views, including on whether or not it's compliant with our underlying policies and raising other questions and concerns that we may have, because our job is to work with stakeholders to make sure that what they produce in terms of guidance works for the state of Maine. I will say, ultimately, at the end of the day, should we find that there are school sports that are happening that are unsafe, either because they're out of compliance with guidance or if there's problems with the guidance, we will review, because it is our job to help work with the Maine public to keep people safe.
Okay, thanks. And my question for Dr. Shah is, with the announcement today of Abbott tests, with the new $5 15-minute tests, and I think they're going to start producing 50 million of those per month. Does that change the testing strategy in Maine at all? Could these be used for schools or workplaces, or do they have a role beyond what you're doing now?
Yeah, so Joe, I think the way you frame that is right. The role for some of these new testing modalities that are coming out, point of care, rapid type test, portable, is to augment what's being done at the Maine CDC laboratory, not to replace it. Many of these tests have features that a big laboratory testing doesn't have, which is to say they're portable, they can be done on the go, you can get results in a couple of minutes. However, you can't get it all. And so many of these new tests have some limitations that don't exist with our laboratory. They may not be as accurate. They may need to be given a couple of times in order to make sure the results are consistent. So what we think, or my view, is that there are many different strategies. There's plenty of room at the table for these different types of testing strategies. We don't think that they will replace one another, but they'll rather help us get a better picture of what's going on. With specific focus on the Abbott test, we really need to see what the testing parameters are. They've received some initial review from the FDA, but as we've seen with other such tests, it's not really for several weeks after use that more and more data become known about what their real world accuracy is. That's what we saw with Abbott's other test, the ID Now. So we're gonna wait and see before we dive in headlong, so we really know how it works in the real world. I'm gonna turn now to Fred Bever at Maine Public.
Hi, thanks for doing this. I have questions for the commissioner about sports and the director about testing. Following up on Joe's questions, Commissioner, I'm still a little unclear on the authority lines here. Your own community, or the state's own community guidelines for community sports, would not recommend football, soccer, or other high-risk sports. Not at the team competition level. So the CDC guidelines, level 1 and level 2, do not include actual competition for football and soccer. So if the MPA says we want football and soccer, and a school district says, yes, let's do it, what do you do? What does the state do?
So I appreciate the question. I will repeat that we really do want to take a good, close, hard look at the guidance. Literally got the guidance 2 hours ago, 3 hours ago, and I don't think I really can opine on that. I will go back and remind people that we did develop the community sports guidelines at a different time for a different purpose. It was in the spring for mostly summer league type of activity. It has not been updated since July 16th as well. I know, for example, the group putting aside what the Maine Principals Association has done, I know that the public health experts have been looking, for example, at soccer, and the public health experts do think that soccer can be placed in the moderate risk group, assuming other public health measures are emphasized, such as limiting play to physically distanced team practices, inter-squad scrimmages, local competition. But that's our guidance for community sports. We will review the recently released guidance from Maine Principals Association and provide them feedback as they request it.
Thank you. Those details are helpful. Director Shah, in terms of the new testing capacity through IDEX and the sort of steady drumbeat of continued swab and send facilities opening up, I want to, and the testing rate increase that you mentioned of 50% in the last week, I think you said. We're talking, when you talk about these numbers, you're talking about tests and results. Is that correct? So the number of results in the last 7 days has increased by X amount when you mentioned that.
That is correct, Fred. And for confirmation, that number is 44%.
Thank you. Okay. And so...
and I'm sorry, Fred, I wanted to just be clear on this. That is not just the Maine CDC laboratory. That is all tests reported to the Maine CDC across the state of Maine.
Thank you. And so I'd like to ask you about the relationship between increased testing capacity and sample taking capacity and the timing of results. I've spoken to several testing facilities this week, some of which send to the state, some of which send to their own facilities. And with the exception of when you have a specific reference from a doctor at a particular group in the state, such as Maine Health or Intermed or what have you, but for the more general facilities that are maybe walk-in or swab and send, where you can get tested without a doctor's reference, the wait time is 3 to 5 days at least. And that includes from the state. And as you know, in Sanford, there were some concerns among firefighters about how quickly state tests were getting back. So I have two questions for you. One, what is the current testing? What is the current timeline for results from the state lab? And two, what is the epidemiological value when there's 5 or more days between when a test is taken and when the results come in? You can increase capacity by 20,000 a week, but what good is that if you don't get results for another week?
Sure. So, Fred, let's start with the turnaround time at the state laboratory, which is really the one thing that Maine CDC can affect. We can't really affect what LabCorp does at their facility in Connecticut or Quest at their facility in North Carolina. What we can control is what the turnaround time is at the Maine CDC lab. And even within that turnaround time, what we can control is the speed with which we deliver a result, conduct the test, and provide a result from the moment the sample shows up at our front door. In that situation, but from the time a sample, a specimen, shows up at our front door to the time that a result is returned to the person who submitted it, 100% of those results now are being reported out within 48 hours. There was a small time period about a week ago where that number fell from 100% within 48 hours to 99.7%, which is the lowest it's been in the past several months. It may take time for a sample to get transported to our lab here in Augusta, depending on where it's coming from. And it may take the doctor's office who ordered the test time to get the result back to a patient. What we can control within the Maine CDC's 4 walls is how quickly we can take a specimen from our front door and get the result back to the healthcare provider who sent it to us. And there again, our wait time on that, our turnaround time, is 48 hours, which is what the public health authorities recommend should be the gold standard. In fact, for many of our results, or our specimens, it's even lower than that. Someone that I'm very familiar with was not long ago, about a week and a half ago, able to go to a swab and send on a Monday morning, and about 25 hours later had their test results, and those were sent to the Maine CDC lab. So there's a lot of there's a lot that goes on in terms of getting a result back to a person, but within the four walls of the Maine CDC lab, that's what our turnaround time is. Now, you ask about the epidemiological value of results that come back 5 or more days after. It really does depend on whether the person is symptomatic, and whether if they are symptomatic, whether they have been quarantining or not, so on and so forth. I think the bottom line here is that if you think you have been exposed to COVID-19 and you wish to get tested, as I noted at the top of the briefing, we recommend that. However, if you have been exposed or you think you've been exposed to COVID-19 and you wish to get tested, which we recommend, your part of the bargain there is to remain in quarantine until you get your results. If you've been a close contact of somebody who is COVID-19 positive, meaning you've been in touch with them for more than 15 minutes within 6 feet, you've got to be in quarantine irrespective of what your test results are. If you were a casual contact and you're concerned, you can get tested, but you still have to be in quarantine, because even a result that comes back a couple of hours later still means you could have exposed other people. So the key here is making sure folks who are getting tested stay indoors in quarantine, not exposing other people while they're awaiting their result. And if they are a close contact, they have to be in quarantine for the entire 14 days.
Thank you. I just like to say, a longtime fan, first-time caller. I appreciate you doing these things.
Good to have you in the group, Fred. Very good to have you in the group. I'd like to wrap up. Commissioner Lambrew, did you have any closing comments? If not, I had a couple things I wanted to mention.
Mine will just be quick, and it's going back to the top with our announcement of the expanded lab capacity. I think it's hard to appreciate on the outside how much work it goes into the kind of capacity the state of Maine has built, starting with the team at Heddle, the state lab, who really have worked countless days, hours, weekends, tons of sacrifices. The IDEX team, which is not doing this because it's the profitable way to go. They're doing it because many of them are Maine residents and care about this state and progress in this public health crisis. Beyond that, we have people who've worked on extra contracts and budgeting and financing, developing the relationship with these swab and sends. People in this commissioner's office have been working night and day to make this happen, as well as the governor. So I do want to let the state of Maine know that there are lots of people who are working for you night and day, who have put us in a position to really be prepared, not only to do the kind of testing we want to be able to do for our residents, but that prepare us for school reopening in the fall and the flu season. So I just want to double down and say thank you.
I wanted to pick up and echo that thanks that Commissioner Lambrew noted. The announcement that the Commissioner made earlier around our expanded testing capacity is significant. But things like expanded testing capacity don't just happen on their own. I mean, certainly they take equipment, they take the mobile trailer itself, they take more chemicals and reagents. But more than anything else in this situation, what they really took was people to make that happen. And I really want to take a moment to thank our team at the Maine CDC Heddle Lab here in Augusta, all the scientists who work in that lab, and take a moment to commend them for the extraordinary efforts that they've been putting in over the last several months. I mean, really, this announcement is your announcement. I want everyone to just kind of consider what they've been working on for the past 6 months. In the past 6 months, 5 months really, they have produced more than 50,000 results for COVID-19 tests. To put that number in perspective, that's more results in 5 months than the entire microbiology section of the lab does in a typical year. They've cranked that out in 5 months. But on top of that, they've been working tirelessly to bring this mobile lab online as well. So while they've been doing the most work they've ever been doing on their normal testing, they undertook this brand new initiative to bring on a brand new system of testing with brand new people, brand new equipment, brand new scientific processes, and they made it all work. And so today's announcement that the commissioner noted is really a tribute to their commitment and their dedication, not only to the people of Maine, but to science and public health. I don't want their work to go unnoticed, so I'd like to really close today's briefing with a special note of thanks to everyone at the Maine CDC lab, each and every one of those scientists, and give them a special thanks, not just to them, but their families for allowing them to put in all those long hours. So my hat goes off to each and every one of you. We would not be here were it not for all of your hard work. So thank you. And with that, I hope everyone has a good afternoon. As always, please be kind and take care of one another. We'll talk again next week.